Hi, it's me, Sheena, and I'm going to have a short lecture about cow's milk protein allergy. We'll talk about its etiology, clinical manifestation, diagnosis, and treatment. Cow's milk protein allergy is one of the most common etiologies of rectal bleeding in infants. This disorder is characterized by the onset of rectal bleeding, generally in children younger than 2 months of age. It is believed that up to 7.5% of the population in developed countries exhibit cow's milk allergy, although there is a wide variation in the reported data. The risk is highest in infants, occurring in 2 to 3% of babies younger than 1 year of age. It occurs generally in children younger than 2 months of age. The risk decreases as children get older, occurring in less than 1% of children 6 years and older. The gastrointestinal tract plays a major role in the development of oral tolerance to food. Through the process of endocytosis by the enterocytes, food antigens are generally degraded into non-antigenic proteins. Although the gastrointestinal tract serves as an efficient barrier to ingested food antigens, this barrier may not be mature for the first few months of life. As a result, ingested antigens may have an increased propensity for being presented intact to the immune system. These intact antigens can stimulate the immune system, driving an inappropriate response directed at the gastrointestinal tract. When a problem with antigen handling occurs, whether secondary to increased absorption through an immature gastrointestinal tract or through a damaged epithelium secondary to gastroenteritis, sensitization of the immune system results. Once sensitized, the inflammatory response is perpetuated with continued exposure to the inciting antigen. This may explain the reported relationship between early exposure to cow's milk protein or viral gastroenteritis and the development of allergy. Diarrhea, rectal bleeding, and increased production of mucus are the typical symptoms seen in patients who present with cow's milk protein allergy. The typical infant is well appearing with no constitutional symptoms. Rectal bleeding begins gradually, initially appearing as small flecks of blood. Usually, increased stool frequency occurs accompanied by water loss or mucus streaks. The development of irritability or straining with stools is also common and can falsely lead to the initial assumption of anal fissuring. Continued exposure to the inciting antigen causes increased bleeding and may on rare occasions cause anemia and poor weight gain. The cornerstone of diagnosis in GI food allergy is the complete history and an unequivocal reproducible reaction to elimination and challenge. Typical symptoms of GI food allergy disappear within a few days upon the elimination of the suspected food. Thank you, and for more videos, please subscribe.